Hi, good afternoon, everybody. Thanks so much for joining us. My name is Olivia Dupont, and my colleague Rosie Garcia and I are both health educators at the Global Tuberculosis Institute. So today we're some lessons that we've learned in facilitating online instruction for professional adult learners during the COVID-19 pandemic. So we'll go ahead and get started. So just a couple learning objectives. We're hoping to kind of summarize some of the steps necessary to adapt your in-person courses to an online format, help predict some potential barriers, and also help identify some tools and techniques for facilitating these courses. So a little bit more about who we are and what we do. As I said, we're both health educators at the Global Tuberculosis Institute. We're located in Newark, New Jersey, and we're part of the New Jersey Medical School. We are one of 4 tuberculosis centers of excellence as designated by the CDC. So we are the center for the Northeastern region. And a couple things that we do here. So we offer clinical services for TB patients at our on-site clinic. We also conduct research around tuberculosis as well as COVID-19. We also facilitate a lot of TB training and education. So sometimes that's traveling throughout the region and offering in-person courses, offering on-site trainings at GTBI. They may be virtual trainings, as well as providing TB training education materials. So COVID-19 really changed the way that we offered a lot of these services. So one huge change was just the transition of all of our in-person courses to online formats for the first time, which is of course a huge challenge. We also saw the redirection of a lot of our staff, our faculty members, and our course participants kind of moving away from TB to focus on COVID-19. So that was a really big challenge. And you can see a lot of our faculty and staff members here working on the front lines of COVID-19. So we're going to talk to you guys a little bit about 2 of the courses that we offer and how we manage them during COVID-19. So the first is our TB intensive workshop. So this is a course for clinicians who are involved in TB prevention and care that we offer every year. It is a 4-day in-person course taught on site at GTBI. We usually have about 25 to 30 participants per session, so we like to keep it pretty small. These participants are mostly healthcare providers from throughout the region who travel here to be in the course. Our faculty members are also subject matter experts from throughout the Northeastern region who travel to teach the course, which is really great. The course is mostly lecture-based, but we also have some interactive games and some panel discussions as well. So we're going to talk to you a little bit about some of the challenges and how we address those challenges to facilitating this course during COVID. So we're going to talk a little bit about just the challenge of transitioning the content online, our busy faculty members, our very busy participants, and then just some technical challenges that we saw. So this first challenge of just transitioning to a virtual format for the first time. So this is a 4-day in-person course. We knew that we couldn't transition 4 full days straight online and kind of still expect people to be paying attention by the end of it. So we really had to kind of reformat how we were going to do this course. So typically for this course, we spend the first 2 days kind of focusing on core concepts of TB prevention and control. We spend the next 2 days kind of diving into more complex topics. So we knew we were going to have to cut down, so we decided to kind of shift our content focus for this course really to those first 2 days and those core concepts, and really just wanted to focus on that core knowledge we wanted to make sure folks were walking away with. So to do this, we kind of looked at the course agenda, and we looked for what pieces we decided maybe weren't going to be quite as essential for this pilot version of the course and decided to cut those out. Then we also worked with faculty members to trim down the existing presentations that we knew we were going to keep in the course, because we know that 1 hour of in-person instruction doesn't necessarily translate to 1 hour of virtual learning. So we really wanted to cut down, make sure that those were short and concise. So we ended up transitioning from about 24 credit hours to 8 credit hours for the course. So it was definitely a big change. We went from 4 days of in-person straight instruction to 4 live sessions plus self-paced work that was spread across 4 weeks. So a big change in format there as well. We also worked closely with the Office of Instructional Design while we were building our Canvas site. They were a really great resource and kind of helped us get more familiar with Canvas as we went along. So our second challenge was just our really busy faculty members. As I said, a lot of them are physicians and nurses throughout the region who are pulled into COVID-19 or are working with staff shortages. So we wanted to figure out how to keep them involved in the course despite their busy schedules. So we opted to move to a hybrid synchronous and asynchronous format for the course. This gave us a lot more flexibility to kind of work with our faculty's schedules. So those people who had a little bit more flexibility, they were still able to participate in live sessions. Those people who are a little bit more busy, we were able to pre-record sessions with them and offer those as self-paced pieces. So like I said, we had 4 live sessions. Those were really focused on the core concepts for the course. And then some of those a little bit more specialized topics we pre-recorded with the faculty members, offered for the participants to kind of view on their own time. We really wanted to make sure we weren't reinventing the wheel with this course as well. So we really tried to take advantage of existing resources. So we reached out to our sister centers of excellence around the country and saw kind of what pre-recorded materials they already had available. What's been great is that as we've kind of recorded new pieces as well, we've been able to share those back with them. So it's become a really collaborative process, which has been great. So this third challenge was just the competing priorities of our participants, who are also healthcare workers around the region, also being pulled into COVID-19. So we were really fortunate to be able to survey our participants ahead of time. A lot of them had signed up for our in-person course, which was canceled because of COVID. So we had their information, we're able to reach back out to them, kind of check on their interest in participating in a virtual training, and see what their availability was like. We were really happy to see that a lot of people were really interested in participating in a virtual course, and that they were willing to spend, up to 6 and 7 weeks on a course, 5 to 6 hours a week. So that was really helpful while we formatted the course. Once we had kind of made our decisions on formatting and opened up registration, we made sure to make the time commitments really explicitly clear for the course. We didn't want to leave any sort of ambiguity because we know how busy our participants were going to be. We also decided to make all of those pre-recorded sessions optional for the course participants, so they could complete them for credit, but they could also choose to opt out and just participate in live sessions, which gave them a lot more flexibility to explore topics that were more important to them without being overwhelmed. We also just tried really hard to stay in contact with participants throughout the course. So we sent Monday morning check-ins, we sent Wednesday evening check-ins because the live sessions were Thursday morning. We also sent a mid-course survey about 2 weeks into the course, just to kind of check on everybody and see how they were doing, and see if they might need more time with faculty. We were really glad to see everyone was doing okay, but we wanted to provide some sort of anonymous outlet to let us know if they had any feedback. So this final challenge was just technical challenges. I think this is something that everybody faces while they're teaching virtually. So we just tried to be really flexible. We went into the course kind of knowing that there would be some hiccups here and there. We were really lucky not to have any sort of major technical challenges, but there were just a couple things here and there, mostly from the participants' end. So sometimes people had trouble getting onto Canvas one day or weren't able to participate in a Zoom session. So we just stayed really flexible. We extended deadlines as needed. We shared content by email if people were having trouble with Canvas. We recorded every live session and immediately uploaded it to Canvas for participants to view if they weren't able to attend. I also just tried really hard to make myself really available by phone and email. So after every live session, at the end of every email, we shared my contact information, let people know they could call me and email me if they had trouble. So really just tried to keep a really open line of communication. And again, just worked with the team at the Office of Instructional Design. They were able to kind of jump into Canvas and help us with any issues, which was a really great resource. Okay, so that was just kind of a whirlwind tour of our TV intensive workshop. Just to kind of summarize, overall the course was really highly rated. We were really glad to see that because it was a pilot version, so that was great to see. That mixed synchronous and asynchronous format worked out really well for us. I would definitely recommend if you're working with busy adult learners, it's a really great option to give people a little bit more flexibility to explore at their own pace. Making those pre-recorded sessions optional also worked out really well for us. Again, gave people kind of the opportunity to explore topics that were more relevant to them in their career without feeling overwhelmed with too much work. And of course, it's really hard to replace the experience of an in-person training, but a lot of people did tell us that this virtual format did make the course more accessible to them in ways it wasn't before. So we're planning to kind of keep some sort of virtual option going forward as well. And then a couple things that just didn't work quite as well. First, discussion forums. Some of those more self-paced homework pieces weren't as highly rated. So we're working to kind of streamline those going forward using tools like Play Pause It to integrate them into videos instead. Again, just the loss of networking opportunities that comes with virtual trainings was a challenge. We're looking to kind of explore some more options for that going forward. If you have any suggestions, please feel free to drop them in the chat. We would love to hear, what you guys have been doing to address that. And then just encouraging participants to join by video is always a challenge. We made it optional, but then often people just choose not to join by video, which makes it more difficult to connect with participants and faculty members. So again, if you have any suggestions for this, we'd love to hear kind of how you manage that with your courses. So that's just kind of a quick overview. If you have any questions, we'll have some time at the end. I'm going to pass it over to my colleague, Rosie, who's going to talk about another one of our courses.
All right. Hi, everyone. My name is Rosie Garcia. As Olivia mentioned, I'll be talking a little bit about our online nurse case management course. And this is a course that is exclusively for TB nurse case managers, essentially nurses that are managing tuberculosis patients. And this course ran over 4 weeks as well, with 4 live 90-minute sessions. And in between those live sessions, we actually had homework assignments that needed to be reviewed. These homework assignments were completed via Canvas as well. And we also had TB nurse consultants that actually participated in the course as course instructors, and they actually provided feedback on the homework assignments through Canvas as well. So those homework assignments were required between the live sessions. And although we've been offering this course for several years now, in 2020, we actually offered the course for the second time via Canvas. So I'll also be discussing some of those challenges that we saw and how we addressed them. Next slide. So this is a list here of some of the challenges I'll be discussing in more detail. Next slide. And the very first challenge that we saw here was transferring and updating the course content. As I mentioned, we have offered this course for several years now in an online format. And we noticed that when we met early on in the year, we met with the course instructors and we started planning out, in advance, how we wanted to go about things, since we knew that COVID-19 would essentially change everything that we had previously used. And we decided that we had so many changes to make, we might as well just go ahead and start fresh and build a new 2020 Canvas course site. And this was my first year with GTBI. And so because of this, I was also learning about the course in general, but I was also learning about Canvas for the very first time, especially the instructor side of Canvas. And needing to build the course, I needed to play catch up with plenty of things. So I needed to educate myself on how to use Canvas. So this is where things got a bit challenging, but at the same time, things got easier along the way. One of two of our course instructors was also new to the course. So essentially she was sort of new just like me, and we were learning about the course as I was building the course as well. And you can see here on the left-hand side, we have a preview of our homepage from the 2019 Canvas homepage. And on the right side, we have the 2020 homepage. One thing that we kept in mind is to be as transparent as possible with our participants. So you'll see here our homepage included a table with the time commitment required for each of the live sessions, and a little bit about the homework assignments as well. Next slide. Now, challenge number 2 was the overwhelming number of registrants that signed up for the course when we first opened registration. Typically, we had about 40 to 50 nurses sign up for the course. And this time around, despite COVID-19 having a huge impact on the workload these nurses had, we had about 70 to 75 nurses actually sign up and register for the course. This now required us to screen each of the nurses, something that we typically did over the years either way. But this time we had a lot more nurses to call. Thankfully, I did have from another one of my coworkers, another health educator, and it was an opportunity for us to screen each of the nurses just to be sure that they were a fit for the course and that the course would also meet their expectations and their needs. So eventually, the wait list that we had for 2021 this year grew larger, and there were some nurses who we were able to refer to a different course. And then some nurses just realized this course isn't for me. Thank you so much for offering it, but I won't be attending. So it worked out for everyone in the long run. We ended up with about 24 people in the course. And as we finalized our participant list, we went on to challenge number 3, where we needed to modify plenty of our content, especially the live lectures. So this is something that we actually went about with inviting new speakers to share their experience with telemedicine. So that actually required us inviting 2 new speakers. And then for each of the live sessions, for the entire course, for 4 of the live sessions, we would be altering a little bit of our plans for that by including a discussion piece related to COVID-19 during each session. Next slide. So now moving on to more modifications for the challenge number 4, we modified the plans that we had for each of the live sessions based on, as I mentioned, based on the changes with COVID-19, of course, that would be taking place throughout the course. And at this time, it was October of 2020. We were noticing that there were various cases or various trends that were fluctuating throughout the country. And some of our nurses were in Arizona, some of our nurses were in New Jersey. So things essentially were very different for a few of the nurses, depending on where they were from. So we also wanted to keep in mind that we wanted to tailor this course to the needs of the nurses that are participating in the course. And in order to do so, we wanted to ask for feedback frequently. So in asking for feedback frequently, we were able to hear from the nurses as the course is going on rather than waiting to the very end. Now, one of the things that we did during this course that we didn't do in previous courses was that we actually implemented a mid-course survey during the second live session. And this took about maybe 5 or 7 minutes at the end of the second live session. And we quickly added a few questions into the chat box. And this worked out very well, where nurses were able to respond to those questions using the Zoom chat box. And we were able to get their feedback very quickly about, just listening to what they had to say about what worked well, what wasn't working well, what they wanted to see next, what we hadn't offered that maybe they wanted to see in the last 2 live sessions that we would have with them. And that's when we were able to add in more time for Q&A and open discussion. And the instructors were able to stay after the live sessions would have actually ended, to just stay around to answer any questions. If there was a participant that had a question about a patient that they were managing, they were able to ask the course instructors for advice. The course instructors are experienced nurses, so they were able to provide that guidance. Next slide. And challenge number 5 was the competing priorities of our participants, similar to the participants that attended or joined in on the TB intensive course that Olivia just reviewed. Our participants are nurses, very busy nurses, nurses that were experiencing staff shortages before the pandemic and even more during the pandemic. So we noticed that we needed to be very flexible with our due dates. There was homework that was required from the nurses that they needed to complete on a weekly basis. They needed to complete weekly evaluations. And because of this, we needed to keep in mind that there were going to be times where nurses couldn't complete the homework assignment on a given Tuesday that it might have been due. Instead, they would probably submit that assignment on a Thursday, and we just needed to stay in communication with them. And this is where I was able to consistently send out emails, reach out to nurses, picking up the phone and actually speaking with them, just checking in on them, checking to see how things were going. There were nurses who became very comfortable with us picking up the phone and saying, "Hey, Rosie, look, clinic is pretty intense this week. Can I get you that homework assignment in another day?" And that worked out very well. So again, just consistent communication rather, with our participants worked out very well. And we did see nurses that needed to withdraw from the course. You'll see here an example of one email I received the day before the course started, where a nurse was no longer able to join us. And then we received other emails, similar emails, where nurses weren't able to stay participating in the course because their COVID-19 activities just became too much. And sometimes these nurses were the only nurse participating in those COVID-19 activities. We also had nurses who were still managing TB patients. And we had nurses that also managed TB patients amongst other infectious diseases. So it was quite difficult for them, as you would imagine. But again, remaining flexible was very important. Next slide. And a few of the things that we learned and we plan to adapt and change slightly to use the next time around we offer this course. Things that worked well, again, compiling resources to share each week. This is when we were able to put together a list each week for the nurses to actually have in the Canvas course site. They were able to go back into the Canvas course site when they would find some time to be able to review those resources, and they would be able to save them for when they needed them in the future. And those resources related to each of the topics that we covered on a weekly basis. Another thing that worked out very well was having tutorials for Zoom and Canvas posted in the Canvas course site. This was especially helpful for people who were not familiar with Canvas. And having access to the Canvas help desk became crucial. It was something that I needed to utilize in order to have the nurses and participants be a part of the course. There were some people who had trouble accepting the course invitation, for example, and this is where the Canvas help desk became especially helpful. And some things that did not work out very well, as Olivia mentioned, expecting everyone to have video on. You can't force people to have their video on if they'd like to keep it off. And then there were times where some people just didn't have the option to do this. Their workplace where they were attending the live sessions through simply didn't have video, or some folks didn't have the best microphone. So there were times where they needed to switch over to dialing into the Zoom sessions. And that's something that sort of worked out well, but still was a challenge at times. The larger challenge with Zoom that we experienced was expecting everyone to have their full name as a username on Zoom. Sometimes, we know some people are sharing a computer or sharing a Zoom account with their partners or children. So this was something that became a bit challenging, and we are looking forward to having that issue resolved in the future rather quickly by letting people know how to fix their usernames or edit their usernames early on in the session. And on the right side here, you'll see these images relate to what we plan to use in the next course offering. We definitely want to see those pre-recorded lectures being used. It'll definitely save time for our participants, as well as the faculty that volunteer their time to put together presentations for those brief lectures. And we do plan on using Play Pause It. It sounds like an amazing tool, so I'm looking forward to that. And we're looking forward to seeing how breakout rooms work as well to increase the participant engagement. And we plan on actually increasing the time that we allocate to Q&A and open discussion. We've noticed that people seem to be getting more comfortable with unmuting themselves and speaking up. So next slide here. As we wrap up here, we're looking forward to hearing from you. Please feel free to go ahead and write your questions in the live Q&A section there, and let us know what you think about anything that we've shared. If you have any questions for us, we'd love to answer those. We're also really looking forward to hearing how you all, anyone that has experience with more non-traditional adult learners, are resolving some of these issues that come up. If you have any suggestions for us, we'd love to hear those. Thank you, everyone.